This episode of HIPcast is brought to you by Datavant. Datavant protects, connects, and delivers the world's most precious data. As the leader in data logistics for healthcare, they enable organizations to achieve their boldest ambitions and advance human health. Join Datavant in fixing the health data supply chain. Datavant securely and compliantly moves relevant health data from where it sits to where it needs to be. Great data logistics gives providers whole patient health data effectively assembled for specific requests and protected to ensure patient privacy. Built on decades of release of information expertise, their products and services create a frictionless experience for managing the flow of patient data. Datavant ensures relevant information is provided only to those who should have it. Learn more about Datavant's offerings by visiting www.datavant.com.
Well, today we have a little bit of a different kind of treat for you. We have Mitchell Josephson here. He is actually the leader of the American College of Health Data Management, and I'm going to read his bio. But just to give a little bit of props to the work he's done so far in leading the American College of Health Data Management. I am also a member of that association, and it's really wonderful. It's a very supportive group, and Mitchell, you're doing a great job. So thanks for what you do. I'm going to read the bio for Mitchell. Mitchell Josephson is fortunate to have a career spanning healthcare data, strategic relations, and innovative solutions in the healthcare tech sector. As the current CEO of Health Data Management Group and president of the American College of Health Data Management, he plays an influential role in shaping health data practices. At Class Research, Josephson spearheaded pivotal transformations from co-founding the largest study of EHR/EPR implementation, adoption, and optimization to advising some of the most influential health systems around the world. His tenure at Align XM revolves around understanding the human experience behind digital transformation. Earlier in his career at Qualtrics, he aided in uncovering experience management applications for varied industries and facilitated strategic collaborations with Fortune 500 organizations. Mitchell, welcome and thank you for showing up.
Yeah, it's so nice of both of you to take time out of your morning to sit down and chat with me. Thank you.
Yeah, well, today we're going to talk with Mitchell about kind of what they're building at the American College of Health Data Management and maybe what the future looks like a little. And then we'll talk about Mitchell's experience with health information professionals and where he finds value in this profession, and talk about some governance and health data in concert with IT, health information with IT governance.
Those are some of my favorite topics, Shannon. That sounds pretty exciting to me.
I'm so excited to have Mitchell here. It's going to be so fun.
So I'm just learning about the American College of Health Data Management. So you mentioned what Mitchell's building over there, and you're a member, and what the entire group is working towards. Mitchell, help me as someone who has zero exposure outside of Shannon to the American College of Health Data Management. What are you guys working on and building there?
Yeah, so I think the best way to walk into that answer is really to kind of spin off. Offline, we were all talking about your why, why y'all are doing this podcast, and that's probably the best place to start, right? So let's just talk about kind of the why, and to do that, the best is to share a personal experience. So within the context of all of us really being patients, the recipients of whatever digital transformation comes, whatever the evolution of the healthcare employee becomes, whether it be on the clinical side, the administrative side. At the end of the day, it is all kind of that last mile of care, where that patient, that provider, a digital transformation, a data set, whatever, is all trying to help deliver the best care or create the best care environment or the most healthy lives we can live, right? The reality is, for me personally right now, I'm going through a situation where I'm right at this centrifuge of everything healthcare, from the perspective of my ailing father, who has dementia. He's in his literal last mile in his life, which I'm sure he'll be passing here in the next, month or so. I have 5 kids. One of them is always getting a broken arm. One of them is always scratching another. We're always having to take care of, the infections that kids share at elementary schools and junior high schools, and just, and so we're always dealing with this, right? But let me just kind of bring this home for me at least, and help explain my why. So I am sitting in a doctor's office with my dad, with my mom. We're finding out we know he has dementia. What type of dementia does he have? How much more time does he have, on this earth? And we're engaging with a neuropsychologist and his team. He's got an NP in the room with him. And we, as patients, especially me as an informed patient, right? Like, I have kind of that burden of knowledge. And so I kind of know, spending over a decade and a half in this industry, really knowing what's going on in the back. You probably experience the same thing when you're in a doctor's office, right?
Mm-hmm.
And I'm realizing that this doctor really does not have the information he needs to be at his best, to be practicing the top of his license. And it's really frustrating to me in that moment. And so I'm not going to get into too many of those details, other than to say, I go home, and being someone who is an early adopter of GPTs, and particularly ChatGPT, even though I've had a lot of experience with Gemini as well, I opened up ChatGPT and I typed in some of the notes in the doctor's note. And more in particular, I asked ChatGPT, I said, help me understand how to explain what's happening to my dad to my 17-year-old daughter. What about to my 15-year-old daughter? What about to my 12-year-old son? What about to my 8-year-old daughter? What about to my 5-year-old daughter? Okay, so in that moment, paying $20 a month, I received more of a personal touch.
Wow.
Than I even came close to receiving in this big, massive cold hospital with a neuropsychologist who had spent, years and years and years of in educational training, and was charging us outrageous amounts of money to take care of us. And in that moment, ChatGPT, in less than, me tinkering around with it, in less than 5-10 minutes, it pumped out an analogy that I could use to explain to all the tears of my children. And then also help to navigate, because I have 6 siblings, to help them understand what was going on with dad, and how we could attack this, right? So think about that. The value that we receive as patients in that moment, isn't that a sad narrative, that with all the information out there, all the data out there, that data was at the fingertips of ChatGPT and not at the fingertips of the clinician? That's the sad narrative today. That's the why behind the American College of Health Data Management. Can we break down silos of information and distrust? Can we raise up and surface thought leadership and expertise that's truly moving the industry forward, a future state where truly the people, the process, and technologies really are coming together to create better care environments? Like, that's the why of the American College of Health Data Management, is first and foremost, can we shine a light on the expertise of the Shannons of the world, right? Of everything that she's been through, can we shine a light on her expertise in a way that helps others learn and grow and progress? I think we can. And I think we can be someone who isn't trying to compete against the Ahimas of the world, or the Chimes of the world, or the Hymns of the world. We could care less. Go and do your thing. What we want to do is shine a light on that expertise and raise that to the surface, and present it in a way that's actually digestible, right? Getting away from that geek side, the data side, where people get lost in the weeds. And even from a lot of times the HIM side, where we're so much in the background of everything that goes on, can we help get beyond that to surface best practices that really kind of cut through and bring that, again, I'll emphasize the people, process, and technologies together to say these are solutions that are working, these are best practices that are tested and true, and let's apply them and actually see our industry move forward from this lethargic state that we've been in to really a boon of just innovation. And this is how I love NASA, right? I love NASA. I'm like, holy crap, what's healthcare doing? We have to find out what they're doing. They're moving so fast on these fronts. How, what can we learn from them, right? So, anyways, I can go on and on and on. I'm gonna talk like Shannon, but I'll stop right there.
Keep going.
Yeah, that's awesome. Well, a couple of things. You mentioned NASA at the end of that, and I just read. I think it was an Adam Grant book. It may have been a different book, a business book. I read a lot of just business or entrepreneurial books, but one of these books that I read just in the past 2 months said, if your company or organization doesn't have a space strategy, that you're missing it. Did you know that? Like this, the way that space is doing, like there are mining of materials on different planets for copper or things that are like copper that can be a replaceable element for some of the things we do here. And they're talking about mining it on that planet and producing it and then shipping it back to Earth. That blows my mind. That's real stuff. That blows my mind. Might have been in Harvard Business Review, actually. That may have been where I read it, but isn't that crazy?
Yeah, well, I'll tell you what, Health Data Management, American College of Health Data Management, we already have our space, our how to mine data in space. We're on it.
It's awesome.
We're on
I love
it. We
I
have
love
that
it.
strategy in place, Shannon. So no worries, we're good.
Well, I want to get to the value of health information professionals in this conversation, but really what I want to say is I appreciate your why, and I appreciate that you're talking about shining the light on the expertise of people in different segments. And there are a lot of cool things that you all do to highlight those expertise there at the college. But I want to say to you that my favorite thing is that you all have masterfully brought together the different segments. So health information professionals, health informatics, CIOs, CTOs, the whole different physicians, value-based care, ACO leaders. And you've brought all those different segments together in one place to have meaningful conversations and do things together. And I know that you have, before we move on, I know you're planning a 2025 event for the American College of Health Data Management can come together. Is there anything you can speak to about that? Because this truly is, this collaboration across different segments of this industry is my favorite thing about the college. So can you speak to the event that you're going to have, or is it a little too early?
Well, so it is too early, and we're really at the planning stages of this. But at the end of the day, it's going to be a continuation of just what you said, Shannon, of what we're actually creating by breaking down the silos, bringing together, to your point, from all levels of a health system, or even outside of that health system, from the actual partners, be it software service firms, right? We look at everybody. We are no respecter of persons. We say that a lot, right? So I don't care whether you're, a CEO of a tech firm. I don't care whether you're a CEO of a hospital. I don't care whether you're, on the front lines of that information system management administration on either side. We care about your experience, your expertise. We have all, especially through COVID, right? Think of the front line, almost wartime type activities and environments that existed. What did we learn at that convergence of the people that came in to create new processes, to leverage new technologies, to actually solve problems? What did we learn from that? And this was even happening before COVID. But how do we break this down and bring those individuals that were actually at that moment of success and say, this worked? And these principles, not only in practical and physical application of the technologies and the processes, but also the theoretical and applicable best practices that were derived from that. How can we then bring that front and center? Because I don't care who you are in healthcare, in any corner you're in, right? There isn't a single process or historical how to do that's not being reinvented by the digital transformation, which then what means what? It means that there's a data set under it. It means that there's technology under it. There's innovation, a need for innovation within it, right? And so it doesn't matter whether you come from biomed side, from a life sciences side. I don't care whether you come from the government side. You're all coming with unique experiences that need to be shared, because I'm guaranteeing right now, even as much as we may be frustrated or bugged at sometimes with the government and the way that they're dealing with things, the way they develop develop policies, we need to understand, because they're kind of the best at creating policy. So how do we take that and then learn from that and apply that to later questions we'll have in this conversation around governance, right? How do we apply that, right? So anyways, the event's going to be really around, I don't care who you are, your walk of life. If you're tenured in this industry, if you've gone through hell on the front lines, and you have some war and battle stories to share, then we want you there sharing and articulating what you learned from that, so that others can take from you. I'm so tired of just healthcare operating in silos. It's just got to be done. And so that speaks to more about what this event will be. But again, a little bit too early to kind of tell details of where it's going to be and all that, but it's coming.
That's awesome. Thank you for that. And I appreciate the passion with which you speak about this interdependency, and everybody has battle scars to discuss. So let's move forward with really what do you see as the value of health information professionals in the whole health data ecosystem?
Yeah. So if I think about this, and I'm going to think about it in the context of almost what's coming at us, but what's coming at us is already here. And you may have had others that have already talked about, artificial intelligence, the opportunity that becomes. I don't see that becoming more of an empowerment position, movement by any other group than the HIM professionals, right? Because there are a lot of HIM professionals. And even I would say that I probably fit in that category of someone who loves the nerdy side of healthcare, the tech side, the information management side, the data side. But I am not a software developer at heart. I am not technically inclined at heart. But what happens is with the advent of AI, and as it continues to become more trustworthy, as it is not so much today, as it becomes more trustworthy, it allows people who understand the inner workings of the health system and the flow of information to become, per se, the kings and queens of the castle, right? Yes. If you understand how things flow, right? now you have something that removes kind of that technical burden of like this technical dependency that we need to have in a lot of cases. When you remove that, now all of a sudden we can become really, really empowered as healthcare information management professionals. But I would even say, think about the example I just shared about me being in that care setting with that neuropsychologist. Think of a well-informed, well-enabled health IM, or HIM professional that is actually collaborating in a governance structure with that doctor to ensure that he or her, in this case, he has the information that he needed to say, hey, have we really thought about this forward, thinking environment where you have this patient, they are, some of these patients are going to be educated enough to be using these, these tools like ChatGPT. What are really their concerns? What's really that value that we're going to offer them in that moment when, dementia being something that is really hard to diagnose. By the way, my dad has has been diagnosed with 5 different forms of dementia. They can't like pin it down to just one because of his symptoms. But how cool would it be if you could actually inform me as the patient's son about, hey, you're going to be going through something really traumatic. Let's get you some information, right? That's really going to add value and not only give that, money's worth type of feel to that patient, but oh my gosh, empower that doctor to have what he needs at his fingertips to really serve that patient better. And I think you're getting well beyond, the EHR at that point, right? You're getting into, let's counsel together on your care journey. Let me actually be a member of that team, when today it just really doesn't feel that way in many settings. That care provider does not feel like a member of that team, either from their own perspective or, quite frankly, as a patient from my perspective. So that is the power of HIM professionals is if you understand the inner workings of that health system and the way that information flows. All these new technologies are only going to empower you if you embrace them and if you're able to upskill. And I think that's an important piece is we need to help them upskill.
That's awesome. I appreciate that. It's interesting. I've been giving some presentations throughout the year on AI and governance and even some SDOH things. But when I give the governance and AI governance presentation in a health information setting, health information management professional setting, one of the things that I talk about is the new roles that I see coming down the pike for us as health information professionals. And there are several, but you actually just highlighted one that I hadn't considered, because one of AHIMA's main primary reasons for existing is patient advocacy. And if you align patient advocacy of AHIMA and the efforts there with a role like you just discussed, that health information professional becomes I don't know the name of the role yet, but I'll come up with one at some point. But it's really incredible that you just talked about how health information professionals can use artificial intelligence to help counsel and inform just by giving information. But the real power there is, like, your dad has those 5 different types of diagnoses because of the various symptoms. You can tailor, because of the efficiency of AI, you could actually tailor the communication that was given to you by prompting the machine, the language model, to say, I need some information and I need you to include how I talk about the symptoms related to these particular diagnoses. You're offering tailored information rather than just that printed EHR stuff like, here's your discharge instructions.
Yeah,
That's amazing.
and I did that, right? I had to do that. I took the doctor's notes out of the EHR, right, through the patient portal, and I started typing information in to ChatGPT. I essentially created a tailored source of information for me that really helped me. I mean, I didn't even tell you guys the part about me understanding each of these 5 different dementias deeper and how they kind of cross associate with each other. Right. I did that on my own as a patient.
Yeah.
Right. But then I was able to, then the story I told you guys, be able to take it and then share with my children what was going on. But yeah, look, I'm an empowered patient. I'm probably on the edge. In fact, there'll probably be like a big, huge like disclaimer on clothes, like, don't do what Mitchell did. This is unsafe. like I understand that. Like I'll always kind of be on the edge of that type of movement in healthcare. But shouldn't these incredible doctors and nurses, shouldn't that be shouldn't the tables be turned?
Yeah.
And the doctors and nurses really should be doing this. I really believe that they can, and they can today, and they can do it safely. There's always a cry for your safety and discretion. I get that, but I'm telling you what I did with ChatGPT. I'm not an idiot. I'm knowledgeable enough to know when ChatGPT hallucinates. And I was able to create something that was very, 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 very helpful to me, and all it cost me was $20 a month, right? So I think there's a huge gap of application of value there, and the tables need to be turned where that doctor, his team, were the ones to be empowered to then deliver that value to me and my family. It just wasn't there, but it can be, and I believe that HIM professionals can lead out on that front if their institutions will give them the space and the authority to do that.
Yeah.
It highlights the fact that the information is siloed, and that includes the governance of that information. As we think, all right, medical record, we're going to live in the file room and we're going to manage the file room, and that's our little world. But Shannon's right. We should have a patient advocacy component of that, of how to walk patients through how to consume this data, how to communicate this data. Mm-hmm. So I guess that leads me to a question of, how do you see health information professionals' governance practices of health data in concert with the IT side of governance of data?
Yeah, so if I think through that, I'm going to go back to my EHR research days, right? So a big part of that research we did all across the world was to truly understand what current governance structures existed within successful deployments, adoption and optimization of EHR systems, and what was missing from the environments that were of poor implementation. And really the metric of success there was how satisfied were the actual users of the EHRs, the clinicians, right? The caregivers. How satisfied were they with the use of their systems? That was our measurement, and then we used that kind of as a baseline, and then back into all these other associated attributes of what makes up a successful implementation and adoption optimization of these systems. And within that, the governance structure was the number one associated attribute of a successful of the success that end users were having with the system. Okay, and so we dug into that deeper and deeper, and really uncovered that at the end of the day, you have got to have a truly shared governance structure, right? Empowered from the top, but yet really almost like enabled from the bottom, meaning that people at the bottom feel empowered to be a part of the governance structure, whether that be they have an advocate for them that sits on that governance committee or that governance board where their voices can be heard. These governance groups are not just sending out surveys to their end users or having sessions of input from these users. They're taking that information, that input, they're doing something with it to better the system, showing those end users that they're actually moving forward from implementation to adoption to optimization, right? So how does that relate to what we're talking about today, right? How does the governance structure, especially as we move forward with the advancement of technologies and innovations that will be hitting us, what does that governance structure need to look like? And I'm not going to pretend like I truly understand the deep underpinnings of the current state of governance structures between IT, clinical, and HIM professionals. But I will say, unless there is a true shared governance structure,
yes,
right? I don't care. You can say, oh well, yeah, we include the director of information management. We include them in our conversations, or we include them in our emails. But if they truly are not at the table and empowered with real authority and responsibility, then it's just a puppet in that, and there's not real movement, and you're still in silos. So we saw that all the time between clinical, between IT, and between operations as they all came together to deploy. Quite frankly, there needed to be more HIM leadership at the table there as well. But we would notice that in those environments where the EHR deployment failed, and we all know this now, but back then we didn't. It was an IT endeavor, right? It was not a clinically led endeavor to implement. It was truly an IT endeavor to implement some new technologies, and they just failed and fell on their face. And then you saw some in the middle ground where they were like, oh yeah, we had the CMO, we had we just appointed a CMIO to be at the table, but they weren't empowered. Right? They weren't empowered. But then you see the environments that were really, really, really successful, and it was from day one. They understood if this was to be successful, we have to have clinicians at the table, and not just clinicians. We need to have the allied health professionals at the table. Yes. We need to understand how an audiologist is going to be using this EMR platform. We need to understand how the occupational therapists are going to be using this EHR. We need to know, so on and so forth. We need their input into this if this is going to be truly successful. It's not just an orthopedic deployment. It is across the entire hospital, right? If this is going to be successful. So yeah, there you go. That's my thought.
It's interesting that you brought up. We didn't know it then, but we know now it was actually an IT-led venture for the most part, and even a little farther back than that. If you think about it, the first set of measures that came out didn't even include hospitals. There was no hospital side of that. It was directly physicians. And then it was almost like the hospitals were an afterthought. And then when you get into it, health information management as a profession, 2011, 2012, that's when we started losing so much of the ownership of what we had had and owned for almost 90 years, or for 80 something years. We had ownership of that governance. And then it was taken because of the IT function. The IT functions became our manila folder with terminal digit filing, but we didn't follow it out the door to IT to follow it with context. And so some practical things about what Mitchell said and how we can bring that together. I looked at, considered the different components of governance for IT and then also for health information. And we each have regulations that we have to follow, right? IT has regulations, and so does health information management as far as how we govern that information. We each have internal policies. We each have processes. We each have retention and destruction requirements. And then we each have exchange. But the exchange component is IT systems, and on the health information side, it's information standards that are specific, right? And those are in a silo. So from practicality standpoint, the easiest way, rather than have my policies as HIM over here and IT over here in a silo, they should be overlaid, where every IT policy that is about information should point to the context of the HIM policy about that information. And every health information policy should point to the IT policy related to what's happening in the network of the systems. They should not be separate. They're not
it's
separate.
Data versus information, right? But pulled together, they can be powerful as long as you put that together. But you're right, there's a lot of silos that are built into there. And I was an HI professional in the IT world during that time frame doing EMR installations. And part of the challenge was the timing aspect of what we had to hit the measures to get the funding back for meaningful use. There was a timing piece there that, that would be great if we could solve these things, but I only have 6 more months to get this out and to get it into production. Unfortunately, a lot of hospitals just threw it against the wall and said, all right, let's do this. Yeah. Now you get the visibility like I do in my day job, is to look at EMR deployments around the world. And there's still countries that are starting that process that it's like they're falling into the same trap all over again. I look at the NHS in the UK. They're having issues right now with their EMR deployment because of how it's happening. Time in Canada, time in Australia, and it's the same trap. And we need professionals that will join into something like the American College of Health Data Management to say, let's go after this together. Let's put data together with information management practices to create a better outcome for our clinicians, for our patients, family members, the caregiver aspect of life, because Mitchell's spot on. As a caregiver, not only are you taking care of the person, but you're taking care of the people around the person and the people within your family. And we need to empower them with information, not just data.
Yeah, that's true. Final thoughts there, Mitchell?
Well, I was going to say, so I was actually turn to both of you. Seth and Shannan, you spent so much more time than I have in the HIM space. I'm curious, and clearly you both have seen, all of this, play out. My question is what's going to change? What's going to be different? Have we learned lessons? Have we really, as an industry, or are we just going to do the exact same thing as we look at these, pending technologies coming at us? Whether it be AI like we've talked about today, or whether it be quantum computing tomorrow, or whether it be issues around data provenance. Are we going to learn lessons, or is this going to just be a continual cycle of just reliving history over and over and over again until we all retire? Like, please give me help. Please give me help.
Is both. It's going to stay the same and it's going to be different. We're going to have some of the same practices, but we're going to learn. And I think a lot of that is dependent on the organization you're in and if the culture is willing to accept failure. We won't accept failure as a rule. So we get scared and we don't want to try this new thing because it failed last time. So we don't fail forward. We're not willing to risk failure because our culture doesn't allow it. Our culture in business says you got to do the best and you got to be the best performer and you can't make mistakes and you go to this and that. And there's a responsibility there. You should not fail on purpose in most cases, right? But when you're employing new technologies, the first thing you have to consider in our world is patient safety, right? Do no harm. Regardless of whether we're physicians and took a Hippocratic oath, we still have to do no harm. But you still have to be able to be in an environment where if you make a mistake on a process, or if you didn't dot the I or cross the T, if it doesn't harm a patient, you should be able to learn from that and move forward. The only way we're ever going to be able to learn from our mistakes is if we're allowed to make them. And we're not typically allowed to make them. And that hurts us. And it also depends on the size of an organization. It's like that. You cannot turn the Titanic with a rudder on a dime, right? I mean, it's just a hard culture change is the hardest change to anchor into any new culture. Into any culture is a new change.
I'm going to tie it back to the beginning of the conversation as we close. And I agree with Shannon. It's both. It's a mixture of both. But I think the biggest change is going to be when we all live on Mars and Elon Musk's new colony from Starship, and we start this brand new and we say, all right, health information, I'm the first HI professional in the Mars colony. We're going to do this the right way. That's going to be the shining example for the future. But I think there's a lot of great work that's being done by the American College of Health Data Management. I think this has been a fascinating conversation, Mitchell. I know we look forward to the next year's event. It sounds like it's going to be a great event. Maybe we'll do a live podcast from the event or something like that. That would be fun. But thank you, Mitchell, for joining us. Thank you, Shannon, as always. And I do want to thank today's episode sponsor, which is Datavant. Datavant protects, connects, and delivers the world's most precious data. As the leader in data logistics for healthcare, they enable organizations to achieve their boldest ambitions and advance human health. Join Datavant in fixing the health data supply chain. Datavant securely and compliantly moves relevant health data from where it sits to where it needs to be. Great data logistics gives providers whole patient health data effectively assembled for specific requests and protected to ensure patient privacy. Built on decades of release of information expertise, their products and services create a frictionless experience for managing the flow of patient data. Datavant ensures relevant information is provided only to those who should have it. Learn more about Datavant's offerings by visiting www.datavant.com. Shannon, until next time, my friend.
I'll see you next time.